Hey, Miss Cooper, it's Dana, and I will be performing my medication administration checkoff. So I'm going to scan my room, excuse the mess, and please excuse any background noise. That is my siblings. So before I get started, I want to say that while in the medication administration room, I will keep the door closed at all times. I will limit interaction with colleagues to essential information only, and I will also not take phone calls during this time and implement the no interruption zone policy. So now I'm comparing my order form to my MAR. So we have an order for morphine sulfate 5 milligrams IM every 4 hours, PRN for pain. Morphine sulfate 5 milligrams IM every 4 hours, PRN for pain. The patient is Jaguar J. Jones. Jaguar J. Jones, MR number 4176352. 4176352, an allergy to penicillin, an allergy to penicillin. Now that I compare my order form to my MAR, I'm going to place this to the side and I'm going to begin my first check. I will perform hand hygiene and I will pull the medication from the drawer. So we have morphine sulfate 10 milligrams per milliliter, expiration date of 12/20/2025, and that's the vial, morphine sulfate. Okay, now I'm going to begin my first check. So I have the right patient, which is Jaguar J. Jones, MR number 4176352. The right medication is morphine sulfate 10 milligrams per milliliter with the expiration date of 12/20/2025. The right dose is 5 milligrams, so half of that will be a half a milliliter. The right route is intramuscular. The right time is every 4 hours. The right indication is for pain. The right documentation is all elements of a legal prescription is present. Now that I did that, I will begin to draw out my medication. So we have a 3 ml syringe, a blunt plastic cannula, and a 23 gauge 1-inch needle. All right, now I'll perform hand hygiene. Now that I did that, I'm going to open my packet, set that to the side. I will open my blunt tip. Also twist this, set that to the side. I'll pull back a half a milliliter of air. I will grab a alcohol pad, clean off my valve, take off my cap, insert air, pull back. Oh no, that was supposed to happen. Okay, I'm gonna get rid of any air bubbles, and then I'm gonna show you that it is 1/2 a milliliter of, or half a milliliter of medication. Do the scoop method, twist off into the sharps. All right, so now we're going to begin our second check. So I have the right patient, which is Jaguar J. Jones, MR number 4176352. The right medication, which is morphine sulfate 10 milligrams per milliliter. The right dose is 5 milligrams, which is a half a milliliter. The right route is IM. The right time is every 4 hours for pain. Right time is every 4 hours. The right indication is for pain. And the right documentation is all elements of a legal prescription is present. So now that I've done that, I'm going to prepare my tape. We're gonna write what's on the MAR. We're gonna use the MAR to write the information we need on our tape. So we have Jaguar J. Jones. Then we have the right medication is morphine sulfate 5 milligrams. We're giving it at 0.5 mLs. And we're gonna write his MR number, which is 417-6352. All right, now that we've done that, we're gonna place our label onto our syringe. Don't know why my Siri is going off. Okay, so now we're gonna take our syringe, and our vial to our patient's room. So we have knock. We're gonna. Why is my Siri going off? That is so weird. So what we're gonna do? We're gonna do the. Oh, sorry. We're gonna go into the patient's room, and we're going to introduce ourselves. So, hey, my name is Dana. I'm a student nurse here at the University of South Alabama, and I will be administering your pain medication. So before I get started, I want to perform hand hygiene and compare my MAR to your wristband. So we have Jaguar J Jones, MR number. Let me pull this down a little bit. Jaguar J Jones, MR number 417-6352, allergy to penicillin, Is there any other allergies that I should be aware of? No? Okay, so now I'm going to begin my third check. So I have the right patient, which is Jaguar J Jones, MR number 417-6352. The right medication is morphine sulfate, 10 milligrams per milliliter. The right dose is 5 milligrams, and which is equivalent to half a milliliter, which we have in our syringe. The right route is intramuscular. The right time is every 4 hours. The right indication is for pain, and the right documentation is that all elements of a legal prescription is present. So now that we've completed our checks, we're going to get ready to give Mr. Jones his shot. The indication for this is that he's in pain. Before giving his shot, we will do an assessment to rate his pain level, and I also will assess the skin to make sure there isn't any redness, edema, or bruising, and I will also palpate to make sure there isn't any tenderness or masses in the area we were giving the injection. So I'm going to put on my goggles. I will also put on my gloves, and I will raise the bed to working height, as well as lowering the side rails. All right. So, Mr. Jones, we're going to be giving this injection in the ventrogluteal area. So, what I'm going to have you do will lay on your side and position yourself comfortably. So, now I will, for an intramuscular injection, before I do that, I'm going to clean the site, throw to the side. And we're going to take out this, put it in our sharps container. For intramuscular, we have to spread the skin. I will insert at a 90-degree angle. I will pull back for aspiration, and then I will inject. Take that out and move it to the sharps. I'll grab, place, pressure. Okay. And now I will position Mr. Jones back comfortably. I will also put lower the bed back to this lowest level, place the call light into reach. I will tell Mr. Jones I will come back in 30 minutes to assess, to make sure that he did not have an allergic reaction or that there isn't any rashes on the injection site area. And I will remove my gloves and place them into the trash, perform hand hygiene, and I would document how Mr. Jones tolerated the procedure, as well as if his pain level has decreased since giving his medicine. And that concludes my checkoff.